My name is Peyton, and I am co-leader of the Health Promoting Built Environments Task Force. And it has been a pleasure to help grow this task force over the past couple of years. And so I will just go a little bit more into who we are as a task force and just provide kind of more background for what our hope is with the rest of the upcoming webinar series. So our overarching goal as the task force is to collect, select, and share knowledge and experience on building design to foster health promoting healthcare environments and communities. And I think you can see how this is a beautiful way of doing that. So again, we're so glad that you're here with us today. We're very focused on finding new ways to facilitate connections across these diverse disciplines all around the world. So our main objectives are to contribute to new partnerships within the design disciplines and beyond to grow the presence of the HPH network. We look to support healthcare organizations in their capacity to integrate evidence-based design within their decision making. So again, another reason that we're not only targeting designers or design discipline members, but also healthcare providers and administrators and leaders or policymakers through this as well. We hope to contribute to the organization of knowledge exchange by organizing and publicizing events like this, and to involving more designers in HPH leadership, as well as to integrate design and design education into the future enhancement of the HPH standards that Fatima so beautifully spoke to earlier. We also are seeking to help adjust broader healthcare systems and policies to include the built environment, because as Oki shared, this is a key way to be able to impact the health of every single being, whether in a healthcare facility or beyond. And we are currently 22 members from across 14 different countries and 4 continents. We are constantly seeking to expand and broaden our perspective. We are actively seeking new members, especially from currently underrepresented areas in South America, Africa, and Asia as well. So if you are interested from these places or otherwise, I'd love to have you join us. But our current members serve as an embodiment, I think, of what we're trying to do in terms of coming and uniting different disciplines. So we have members from architecture and healthcare planning, as well as engineering and technical architecture, design researchers and strategists such as myself. And then we also have academics and researchers and professors, as well as health systems leaders and policy representatives. So we're lucky to be quite a diverse group, but we're, as I mentioned, seeking to further expand our perspectives going forward. And our current initiatives are focused a lot on this knowledge sharing effort that is the core of our focus. So we have a web page that we are continuously updating, but it has references to national knowledge centers, all about what Oki gave a great introduction to around evidence-based design. We are working on a paper within one of our subcommittees on enablers and barriers of health promoting built environments. We're hosting a webinar series for healthcare leaders and architectural designers to share more information. And then, I don't know that we mentioned this yet, but after we have the session today live, we will be posting it both to our website and then also to our YouTube channel. So the purpose is for this to be a continuously accessible source of hopefully very tangible and understandable knowledge across the different disciplines. We are active participants in different conferences all around the world and other webinar series with partners. And on this topic, we are focused on expanding our partnerships with other task forces of the network, like Fatima mentioned, and beyond. Throughout the design and health disciplines with other groups that are working to support similar interdisciplinary efforts. And finally, a little bit more about our upcoming webinar series, just to reiterate a little bit what we've shared so far. So who are these intended for? All are welcome. Again, we really encourage diverse perspectives, but we are especially targeting those in the health and design disciplines. We'll be sharing knowledge about the role of the built environment. And as Elke mentioned, we're going to dive deeper into a lot of the different topics that we have alluded to today. So if it's piqued your interest, make sure you come back and join us again or watch them afterwards. As mentioned in the next point here, we will have this global live stream, but we will also host the webinars monthly on YouTube. And the episodes, the dates and times specifically will be announced on LinkedIn several weeks in advance. We do already have our next session scheduled for March 11th, and we will be announcing that very shortly. But in that session, we'll be focusing more on the fundamentals of healthcare design as well as the intersection of evidence-based design and building design. In future sessions, we will also be covering more of the healthcare design guidelines, design for salutogenesis, design for health equity and empathy and vulnerable populations, and all sorts of other topics as well. And this is another area where we absolutely welcome input. So if you want to drop into the comments or speak up afterwards about other areas that you'd be interested in learning more about, we are more than happy to try to tailor sessions around this. And finally, as we've mentioned many times, okay, if you could just go to the last slide. We are so glad you were here with us today. Thank you again for joining. We're always seeking new members and new partners, new collaborators. So if you have interest in this, please feel free to reach out to Elke or myself. Either here are our emails or on LinkedIn. You can also scan these QR codes to follow us on LinkedIn, as well as to visit the website that we mentioned with more resources around evidence-based design for health promotion.